We decided to look at how students in senior high school utilize antibiotics because currently we have a problem with antibiotic resistance, which simply means that a lot of the conditions we have are not responding properly to the antibiotic options that we currently have. And we thought that how our students utilize these antibiotics is very important because they are the future. So ensuring that they have adequate knowledge or the correct knowledge on how to utilize some of these drugs is very important in our war against antibiotic resistance. So we interviewed 328 students across 3 regions in the country, and we found that about 80% of them use antibiotics. Of that 328, we had 30% of them using antibiotics every month, which is quite alarming because antibiotics are supposed to be used for treatment of specific infections over a specific period of time. So utilizing an antibiotic every month constitutes misuse of the drug. We also found that most of them utilize these antibiotics for the treatment of cold and flu. And that is problematic because usually a cold or a flu is being caused by a virus. And antibiotics are indicated for bacterial infections. Yes, so bacteria is very different from viruses. And what it means, if you take an antibiotic for a viral infection, it's not likely to work. Yes. And the fact that it's not working, but you're still taking the drug and it's affecting systems in the body. We also found that the conditions which they mostly treat using those antibiotics are colds and flus. Flu is usually caused by viruses. And viruses are very different from bacteria. Antibiotics are usually given to help manage conditions that are caused by bacteria. So if you take an antibiotic in an attempt to treat a viral infection, it is not going to work. And so that will constitute misuse or abuse of the drug, and the misuse can lead to antibiotic resistance.